Hello, I'm Michael Cornfield of 720 Strategies. Welcome to this special We Work for Health advocacy webinar entitled The Time Has Come, Communicating with Congress During the Summer of Healthcare Reform. This webinar has been added to our monthly roster because it is now clear that this summer marks a crucial period for national policy making on healthcare. We appear to be in a stretch drive for major, perhaps comprehensive legislation to deal with healthcare costs, access, and protocols. The Democratic Party has established a schedule to report a bill before the August district work period, with the ambition of placing legislation on the President's desk in the fall for his signature. Thus, the calendar you see in front of you has white spaces which designate all important times for constituents to contact their elected representatives to make their views known. District work periods are times that legislators dedicate to listening. This summer, every member of Congress knows how big and important healthcare reform is. Members want to hear and be seen hearing from constituents. They will interpret silence from particular interest groups and even relative silence compared with other groups sharing an interest in healthcare as a lack of commitment and concern. And as they listen, they are on the lookout for material they can use in the public statements they will make to explain their votes. There is a premium right now on personal stories and indisputable facts that shed light on how the various healthcare alternatives being considered, including the status quo, affect constituent lives, jobs, and finances. There are several good methods by which you can step in and provide this material. Put together delegations and visit members in their district offices. Attend the town hall meetings they schedule. The more people with you, the better. Wear campaign t-shirts to public events such as 4th of July parades and barbecues. Make phone calls using the number you see on the screen, 1-888-993-4669. and you will be patched through to senators' offices. Check weworkforhealth.org, the campaign website, regularly for logistical information and background information for your messages. The best you can do in these forums is summarized on this slide. Be focused. Don't get bogged down in process and policy details. Instead, talk about the lives, jobs, and finances of constituents. Be local. Tell stories about constituents you have encountered and tried to help. Be current. Keep up to date on message points and the status of legislative alternatives by checking the weworkforhealth.org website, among others. And be friendly. The behavioral ideal for constituents contacting Congress involves being prompt, attentive, courteous, and at their service as a resource. Here are 3 core messages to bear in mind as you establish contact, arrange meetings, and communicate with Congress over the next few weeks. The biopharmaceutical sector is committed to making healthcare reform a reality this year. You are proud that biopharmaceutical companies like yourself have committed to help close the coverage gap in Medicare Part D. Comprehensive health care should expand access, invest in prevention, include medicine in benefits packages and programs, and protect biosimilar data for at least 12 years. Good luck moving forward. Until next time, I'm Michael Cornfield of 720 Strategies.